The first speaker is Professor Motoyuki Yuasa, Juntendo University, Japan.
Thank you very much for my friend, Dr. Myo. My name is Motoyuki Yuasa, professor of Juntendo University, Tokyo, Japan. Let me make a presentation on community response to the COVID-19 pandemic containment measures in Japan. Okay, this figure shows the confirmed number of the positive case and deaths due to the COVID-19 among several countries in the world. Belgium, for example, had 60,100 cases with COVID-19 and 9,661 deaths as of 17 June. Japan had 17,439 positive patients and 929 deaths by June 17. Case fatality was 5.3 and 0.73 deaths per 100,000 people. Especially in metropolitan Tokyo, had 5,709 confirmed cases and 320 deaths as of yesterday. As you know, Tokyo is the biggest city around the world, but its prevalence looks quite low in comparison with other megacities, particularly in the Western countries. However, compared to Asian countries, which has very lower fatality ratio, Japan was the second rank of the worst higher mortality, following the Philippines. This map shows some extent of white circles indicating an accumulated number of COVID-19 positive cases in Japan. Look at the map from the north to south. Sapporo, Kanazawa, Tokyo, Nagoya, Osaka, and Fukuoka are big cities, as well as having a large number of patients. Iwate here, Iwate is the only one prefecture which has so far reported no case yet. This upper figure, this upper figure shows the trend of tested positive cases per day. Until the middle of April, there was increasing rapid of patients. Therefore, the Japanese government declared the state of public health emergency on April 16 nationwide. The lower figures indicate the number of PCR tests per day, meaning that the number could not increase in spite of growing social needs because of some restrictions. Prime Minister Abe hesitated to declare the state of pandemic emergency to maintain economic activities. So the declaration was delayed to announce compared to other countries. In addition, central government and local government order no lockdown policy, no penalty, and no punishment for the passengers working outside, no strict regulation to control people's activities. Instead, the Prime Minister emphasized only avoidance of three C's. The crowded space with poor ventilation. Second C is crowded places with many people nearby. Third one is close contact settings, such as close range conversations. The Japanese government just requested a self-restraint from going out to Japanese people. People were required to stay home. If they need to go out, they should keep a social distance. WHO, foreign government, and many specialists expressed that the Japanese measures and policies may be insufficient to tackle the pandemic. This photo shows that the local government officers announced stay home to passengers in the streets in the Shinjuku areas, downtown of Tokyo. As a result, most people obeyed governmental request. They had gone home. Supermarkets, banks, and hospitals has been open as usual, even after pandemic happened. You can see some examples of Japanese community and containment measures, as same as several observations in other countries. Train has been also on an ordinary schedules every day, but there are very few passengers. We can enjoy seeing some heartful artistic works everywhere. Most of shops and restaurants has been closed to obey public request. So a lot of people were joining in online drinking parties. All Japanese love watching cherry blossom and enjoying eating and drinking under the trees in every spring. But in this year, we are required to change our cultural behavior. Government repeatedly suggested to refrain from watching cherry blossom so that most people could not enjoy in cherry blossoms in this spring. Without forced regulation and any penalty, and without any digital devices to reveal personal privacy, just only by asking a self-restraint to avoid face-to-face contact. The detected number of the COVID-19 infected cases has decreased since the declaration of the state of emergency. It still remained in low level up to date. This phenomenon looks unclear to understand. Is it needed to consider why Japanese society has been under control against COVID-19 without any forced measures and policies? Professor Dr. Shinya Yamanaka, he's a winner of Nobel Prize in Physiology or Medicine in 2012 as a founder of iPS cells. He mentioned that why Japan controls the pandemic may be based on unknown reasons, which he names Factor X. He enumerated possible reasons, such as dedicated national cluster measures led by Minister of Health, students sharing of a sense of crisis, and high hygiene awareness. Life culture with huge handshakes and loud conversations, Japanese genetic factors, BCG, vaccination, and so on. He encouraged the Japanese academic society to examine which factor X can be contributed to control the pandemic. I think it is necessary to analyze and share these factors for preparedness toward the second or third waves of pandemic in the near future. Thank you very much for your attention.
Thank you very much, Professor Yuasa, for the
a very interesting presentation.